A national crisis is showing signs of getting worse as we speak about another drug. We're talking about fentanyl. The CDC says it is bleeding into every corner of our nation. Some of it looks like candy. It only takes a small amount to kill a person. In Colorado, the Department of Public Health reports that fentanyl is one of the most common causes of overdose deaths in the entire state. Methamphetamine is not far behind. Illegal drugs are flooding into the country from the southern border. More than 3.5 million fentanyl pills confiscated in just Arizona this month. And another bus seized 162 pounds of meth. Joining us right now, Dr. James Besante, an addiction medicine specialist. I have to ask you before we get to some of the questions, a large percentage of the experimental drugs that young people are unfortunately rolling the dice on, they're laced with fentanyl. I want to ask about the glaring warning signs for parents and grandparents that might be watching that could indicate fentanyl use.
Yeah, no, first, thank you for having me. This is a really important topic to discuss. And we're seeing overdoses across the country, overdoses in individuals not intending to use an opioid. You've reported on this network about rainbow fentanyl. This is fentanyl tablets that are pressed in certain colors with certain insignias on them, and they can easily be mistaken for club drugs like ecstasy. We know that people are ingesting drugs that they don't know what the substance is. A recent study in Great Britain showed that 45% of tablets that were marketed as ecstasy did not contain the drug. And increasingly, we're seeing fentanyl adulterate these substances. The most important thing for families out there is to keep lines of communication, open lines of communication. You want to have open and honest conversations with your children if you suspect substance use, but more importantly, reach out for help. Never worry alone. Ask for the help of an addictionologist or a trusted healthcare professional. There are a lot of resources out there for those needing help or those parents who are concerned about their children.
Yeah, and the Department of Justice actually put out an alert about those rainbow fentanyl pills that you mentioned, how young people are being lured into this dark, dark world of drug use. Now, drugs are coming again into the nation every single day. When I was growing up, there was the DARE program, and a program to try to get kids to stay away from drugs. What can we do to combat the amount of drugs coming into this country?
Yeah, it's a great question. The most important thing is that we expand access to treatment. Treatment works. Drugs like buprenorphine, methadone, they're associated with a 76% reduction in overdose in 3 months. Unfortunately, many individuals do not have access to these medications. Many Americans do not have access to OTPs, opioid treatment programs, which dispense methadone. They also offer other medications like buprenorphine or naloxone. And these shortages of OTPs are seen nationally. However, the gap is greatest in rural communities. So part of talking about the overdose epidemic here in the United States of America is that understanding that it doesn't affect all communities equally. And when you mentioned at the top the data coming out of Colorado, well, those trends have been seen across the country. But interestingly about Colorado, it has an enormous rural population. And again, the rural communities are being disproportionately affected by overdose because oftentimes they have the least access to treatment, and patients seeking treatment are traveling long distances to access it.
Yeah, and Colorado, of course, famous for some of its drug laws and for some of its drug issues. But thank you so much, Dr. Besante. All of us need to be paying attention very closely and protect those we love. Thank you again.
Thanks for having me.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.